Hi, I'm Paul. We're going to do a patient assessment for cardiac chest pain and assist the patient with nitroglycerin. So we've taken the call for chest pain. We're going to size up the scene, make sure we recognize and remove hazards. We're taking standard precautions. We consider need for additional resources, see none. So I'm going to approach the patient and form a general impression. I see an alert patient, and I'll do a primary assessment. Hi, I'm Paul. I'm here with the ambulance. I'm sorry I'm not feeling well. How are you feeling?
I have shortness of breath.
Okay.
Having a hard time breathing.
Okay. So I see that breathing doesn't appear to be labored. I'm going to have my partner get the pulse oximeter going and break out a nasal cannula. So anything else besides the little bit of difficulty getting air?
Well, I have pain in my chest.
Yep, right there.
Yes, right here.
What can you tell me about the pain?
It radiates up into my neck.
Okay. And if you take a deep breath, does it make the pain worse?
No, it's unchanged.
Okay.
It's just
Anything
there.
you can do to make the pain better?
No.
Okay. So initial appearance of cardiac chest pain suggests immediate transport with the patient as relaxed as possible. O2 sat comes in at 92, so we'll go for a nasal cannula. So your oxygen's really pretty good, but you might feel better with a little bit more. So we're going to use this thing that's just going to rest on your upper lip, and it just tucks behind your ears just like that, and hopefully that'll make you feel a little bit better. So we're going to, I think we should go see a doctor. They're going to want to see you, but we're going to take our time getting to the hospital because it's nice to see that you're really doing relatively well. So we're going to get the cot in. My partner and I will bring the cot in, make sure we've got a blanket. So we'll get the patient on a cot. You could put your feet up like that, transport in a position of comfort, which would likely be head up. We'll get out into the ambulance, and but before we do, take any medications?
Yes.
What kind of medication?
I take nitroglycerin.
Okay, and anything else?
No.
Okay, so we're going to bring along the nitroglycerin because we might take some in the ambulance. Have you taken any of the nitroglycerin today?
Not today.
Okay, so we're going to bring along the nitroglycerin, and we might like to bring along some stuff to make you comfortable in the hospital. It could be a little while, so we might bring along comfortable clothing, a sweater, slippers, whatnot.
My therapy pet.
Therapy pets too, like a llama maybe. So we're gonna transport. We'll skip the siren, but we might use the lights. Okay, so in the ambulance, I'm going to do a sample history, and I'm going to do OPQRST to focus on the cardiac pain. So initially what I'm feeling is that the skin is warm and dry, and as far as ABCs, I've got an alert patient, clearly a patent airway. Patient is speaking in complete sentences, showing no respiratory distress, so evidently moving air just fine. So tell me again about how you're feeling.
I have pain in my chest.
Pain in your chest. So what are the most important things that we want to talk to the doctor about once we get to the hospital? The pain in the chest, anything else?
And the hard time breathing.
And the hard time breathing. Okay. And you think that'll be it?
Yes.
Okay. So I'm not coming up with any significant signs. We've clearly got a couple of symptoms. Are you allergic to any medications?
No.
Okay. And besides the chest pain, do you have any significant medical history?
No.
Okay. So the P in, we covered, are you taking any medications? And now we've got your past medical history. When did you eat last?
I had Lunch a couple hours ago.
Lunch a couple hours ago, and when did you drink last?
Alcohol?
Anything, any liquids?
With lunch I had a glass of club soda.
Very good. Okay, so lunch a couple hours ago. So I'm gonna note the last intake, and tell me about any events leading up to your need to call today. Anything significant going on? Any important events that maybe the doctor would want to know about? Any extra exertion?
I had a stressful day at work.
A stressful day at work, okay. Thanks. Now, so that'll cover the E in sample and the O in onset. So can you tell me the pain? We've already covered that nothing seems to make it feel better or worse. Tell me about the quality of the pain. What does it feel like? Have you ever had pain like that before?
I've had it before, yes. It feels like somebody's gripping my heart and squeezing it.
Okay. And so point again to right where the pain is.
Right in the middle of my chest, really.
And does it feel like it goes anywhere?
Well,
From
it
there.
radiates up
Right.
mostly.
Just like before.
Mhm.
And are you feeling about the same way you felt when I first met you?
Yes.
Okay. And on a scale of 1 to 10, what would you say about the level of the pain?
7.
Okay, 7 on a scale of 1 to 10. And how long have you been feeling that level of pain?
Well, I didn't feel so good when I woke up this morning, and then I went to work, and it was a little stressful and started to get worse. So I came home. I thought if I just had lunch and relaxed, I would feel better.
Mm-hmm.
But I don't.
Okay. Okay. So it may be some hours that you've been feeling this way.
Mm-hmm.
Okay. So we've got the sample history. We've done OPQRST on the pain. We're going to do a secondary exam, including a full set of vitals. So I'd like to see what your pulse feels like, and I'm going to count it up here. And okay, feels pretty good, but a little quick. Pulse of 100. We're going to get a blood pressure, and if I use this on, great. And we can go right over that shirt. And while I'm doing the blood pressure, I'm going to sneak in a respiratory rate. And let me feel that pulse again. So 20 breaths per minute, nothing significant about rate or quality. I'm also going to just have a little listen to your lungs. I'm going to check here, 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 and here. And I'll just drop right down like that. And I'm just going to scoot up under. Yep. Sounds good. Good. Okay. Just going to set that there. Go for a blood pressure. Okay, I'm gonna note the blood pressure of 140 over 100, noting it's significantly higher than the 100 systolic, which leaves open an opportunity to help with nitroglycerin. I'm gonna have you chew on a couple of baby aspirin. 2 at 81 milligrams is gonna be the low end dose. Patient's relatively low body weight, we're gonna start with just 2. Do you have any allergies to aspirin?
No,
Do you have any stomach ulcers, any issues there? Okay.
no.
I'd like you to chew on these 2 aspirin. You can have those. And sorry I can't give you any water to wash it down, but just chew them up and swallow them the best you can. So I've got your nitroglycerin here, and I think it might help to take it, and the doctor would like me to help you take it. So I'm gonna do the 6 rights. I gotta have the right patient, the right medication, the right dose, right route, and right documentation. So just wanna confirm that I've got the matching up with the name here. Can you tell me your name?
Susan Johnson.
Okay, so I see that name matches what's on the bottle, and I'm observing the medication. It does say nitroglycerin on the bottle, and I'm going to open it up, and there are small white pills inside, nothing else. So I'm confident that we've got the right medication. The dose is 0.4 milligrams, so I got the first 3 now. We're gonna go sublingual, so that's the right route, and then we're gonna do the right documentation, noting the time and the patient's response. We're gonna note the medication and the route and the dose. So this nitroglycerin pill goes under your tongue. You don't chew it, and you let it dissolve under your tongue, and it's expected to burn and maybe even give you a headache. But the doctor would like you to do this because he thinks that it might help your heart to do this, and it might even make you feel better. So here's one of your pills here, and you just put that right under your tongue and let it dissolve under your tongue. Okay. We'll also finish out the set of vitals with a 12 lead. We'll look at the pulse ox again. We'll reassess every 5 minutes and go see a doctor.